Hello, everyone, and welcome to today's virtual awareness session on multiple sclerosis. I'm Dr. Anushka Amlani from the Integrated Health and Wellbeing Council, and we're delighted to bring you this important discussion in collaboration with Roche. Our goal is to shed light on multiple sclerosis, its challenges, treatments, and ways to improve quality of life of those affected. We are honored to have with us Dr. Neetu Ramrakhiani, Director of Neurology at Fortis Escorts Hospital in Jaipur. Welcome, ma'am.
Thank you.
With over 20 years of expertise in neurology, Dr. Ramrakhiani is a highly respected specialist in managing multiple sclerosis. She also runs a dedicated clinic in treating multiple sclerosis cases. Her experience and insights will provide us a deeper understanding of MS and its impact on patients and their families. Thank you for joining us, and we look forward to having an informative and engaging session with you, ma'am.
Yeah, I'm honored to join. Yeah.
As we get started, my first question is, ma'am, can you explain to the audience what is multiple sclerosis and how does it impact the lifestyle of a patient?
The multiple sclerosis is something which we call as a demyelinating disease. So it is a disease which mainly affects the central nervous system. So when we talk of central nervous system, we are referring to the brain and we are referring to the spinal cord. Now, the brain actually has two parts. It has something which is called as a white matter and something which is called as a gray matter. So multiple sclerosis predominantly affects that parts of brains which are more affected, which are more ingrained with white matter. So when I use the term autoimmune, autoimmune is a phenomena when the immunity goes wrong. So the immune cells, which are supposed to be there to help us take care of from the outside, external factors like infections, actually start attacking the normal tissues. So this is the basis of the disease. So it's in medical terms we call it autoimmune. That is the first term. Second is inflammatory. That means there's a lot of inflammation happening inside the body. And demyelinating. So the net result of these diseases is the myelin sheath of the brain gets damaged. So that is what basically the disease is about.
Thank you so much, ma'am, to helping us understand what are the changes that go inside the brain that lead to this
Yeah.
condition. Ma'am,
Yeah.
as we move forward, what are some early warning signs of multiple sclerosis and how can they be differentiated from other neurological conditions?
Yeah. So the warning signs of multiple sclerosis are often one is the age group. So it normally affects the young people. And these signs, which are fairly typical of an onset of an MS attack, may be in form of optic neuritis. So optic neuritis means difficulty in vision from one eye. It can also occur in form of double vision, difficulty with balance, tremors, pins and needles sensation, or difficulty in walking. So these symptoms actually depend upon which part of the brain or the central nervous system or the spinal cord gets affected. So to differentiate from other similar diseases, actually we need a good clinical history in an appropriate age group. And then you have other investigations like an MRI, a VEP, or a spinal tap, which actually helps you come at a final conclusion.
Thank you, ma'am. Ma'am, as we go further, we have understood the kind of early warning signs, but can you also break down the different types of multiple sclerosis and how do they vary in terms of their progression and symptoms?
So, multiple sclerosis is typically what in medical science we call as relapsing remitting. There are some diseases which come in one go. And unless and until you treat those diseases do not improve. By contrast, an MS lesion, often you would have one episode, and whether treated or untreated, at least in the early phase, these symptoms will go away. So, and then maybe after 6 months, 1 year, another episode will happen. So this is the typical way MS happens. So this is called as relapsing remitting. That means you have relapse or an episode, and then that episode remits or improves by itself. So the most common form of MS is a relapsing, remitting pattern of MS. And then you have certain other patterns. Now, these other patterns are in form of secondary progressive MS. That means the beginning is in form of episodes, and then gradual progression starts happening. And then there is a third variety, which is called as primary progressive MS. Now, in primary progressive MS, the disease is monophasic. That means you have symptoms, and those symptoms do not improve. They would keep on increasing. So that is the most uncommon and the most difficult form of MS to treat.
Thank you for your insights, ma'am. We have already understood what changes happen neurologically for MS to occur and some of the early warning signs. But before we move into the treatment and the management part, I would like to understand how significant are genetic and environmental factors in the development of MS, and are there any preventive strategies?
So typically, MS was thought to be a disease of the West. So the maximum patients of MS initially were seen and diagnosed in the European belt and in the Americas, and typically the tropical countries, the countries which are located around the equator, were thought to have lesser incidence of MS. However, now we know that there are cases of MS almost in all parts of the world. As far as the genetics goes, yes, there is a genetic predisposition to development of MS. Also, MS happens more frequently in women than in men, which is actually true for all autoimmune diseases also. So the frequency of multiple sclerosis is much more. Almost the figure varies from 1.4 to 2 female versus 1 male. So these factors actually are important.
And ma'am, how about the preventive strategies when it comes to these two, dimensions like the genetic involvement and the environmental factors? Are there any preventive strategies in such cases?
Preventive data is very scarce, but what we know is that childhood obesity or adolescent obesity does predispose to development of MS, as is with tobacco intake. So there's a small risk factor associated with these two conditions. Initially, there was a lot of hue and cry about vaccinations producing MS, but now almost the jury's out that vaccines per se do not have a very high chance of producing MS. So, what is typically the trigger? See, what happens is you have a genetic predisposition, and then the trigger can be some small viral infection. So, with the development of that viral infection, your immunity goes awry, and your B and T cells, they start interacting in a manner which produces inflammation. This inflammation goes around the brain and produces the typical lesions and the typical symptoms of MS.
Thank you, ma'am. Ma'am, before we delve into the treatment and the management aspect, one more question regarding diagnosis. How
Yeah.
important is early diagnosis in managing multiple sclerosis, and what challenges exist in identifying the condition early on?
So the problem with multiple sclerosis is there's a very poor recognition of the symptoms of multiple sclerosis. So often, patients, before they reach us or other neurologist, a patient would have consulted at least 4 to 5 doctors, varying from their primary care physician to to their GP before somebody is able to figure out what is happening with them. So early diagnosis and early labeling is very important because unless and until you diagnose this disease, you would not be able to initiate any preventive medication because we typically call this disease as an iceberg disease. So like an iceberg, There's only a very small part of the disease which is visible above the surface. So there is a lot of activity which is happening inside the brain. When we diagnose the disease, we have to cover both the activity which is happening outside, which the patient can recognize as symptoms, and the damage which is happening inside the brain, so that the disease doesn't convert from relapsing remitting to secondary progressive. So that is important.
Thank you, ma'am. Ma'am, as we move forward, what are the treatment options that are currently available for multiple sclerosis, and how do they help in managing the symptoms or slowing the disease progression?
We have a lot of options at the moment for management of multiple sclerosis. So there are platform therapies which have been around for the last 20 to 30 years, like glutamer acetate, like interferons. Now, these are typically used for a milder form of disease. They're often injectable in nature, but the safety data is fairly good. Then you have the intermediate levels, which will cover the disease with moderate or severe nature. And then you have the therapies which are highly effective. Now, these highly effective therapies actually would slow down the disease in a major way. So for those patients who have a very active disease, these medications are a boon in itself, because they would actually decrease the inflammation part in the brain and prevent the damage to the gray matter. However, each and every medication, it comes with its own set of issues. So because we are lowering the immunity, some of these medications will make the patient more predisposed to other kind of infections. So
Right.
your doctor has to understand your disease, understand the severity, understand the progression, and then would recommend a set of medications which would be suitable for you. Often, which medication is to be added for a person would be a dialogue between the doctor and the patient. So sometimes the choice of medication would also vary depending upon if it's a young woman who's just got married and would like to have kids. I would put the person on a different set of medications compared to somebody who's already completed their family. So a lot of issues, including personal preference. Like some patients, their personal preference is not to go on injectable therapies. Then comes the cost of the therapy, the preference, the side effects, and because this is a disease typically of young women, reproductive considerations, availability of medication. So there are a lot of factors which would go into the choice of the disease. But at least at this moment in India, we are lucky. We have availability of a lot of medications, including some medications which are very, very effective.
Thank you, ma'am, for helping us understand the availability of options and also highlighting the nuances between the treatment preference from the patient's side and
Yeah,
what the
yeah,
doctors got to offer.
yeah.
Ma'am, could you mention some of the practical strategies that patients can use to manage some of the symptoms like fatigue, mobility issues, and cognitive challenges?
So one is build a good support network. In India, we are still a family-centric, cohesive uh,
Yeah.
set of people. So use and tap your support network. Second is get in touch with your local MS groups or clinics, because sometimes patients can help each other better. So sometimes somebody has already gone through a journey, so he can help diagnose a newly diagnosed person better. So that is the second option. Third is what we call as energy conservation techniques. So you have to schedule your day in such a way that your most important things usually get done. Both are issues of fatigue. Now, fatigue is multifactorial. Fatigue can also occur because of poor sleep. It can also be experienced because of the disease itself. Fatigue can sometimes also be the manifestation of an infection, or at times in patients, it can be a part of depression, because it is a heavy burden for a person to carry. I mean, you are in your prime, you've just got married, just joined a job, and then somebody gives you a diagnosis of multiple sclerosis. But for for most of the patients, with proper medical therapy, life remains fairly normal. So we are seeing less and less of the disabled patients we would see a few decades earlier. So if you hit the disease hard in the early phase of the disease, recognize this disease, most of the time we would be able to prevent disability in such patients.
Thank you, ma'am, for your valuable insights. As we move forward, how can lifestyle changes, including diet, exercise, contribute in better symptom management when it comes to multiple sclerosis patients?
So there is a relationship with vitamin D intake. So it is believed, and certain studies have also shown that maintaining good levels of vitamin D independently work in preventing relapses in multiple sclerosis. Second is staying physically active. So whatever is your level in presence of the disease, good exercise and good level of physical activity always is a good preventive and protective strategy against this particular disease.
Ma'am, there are a few questions that you've already answered when it comes to, the kind of caregivers and supporting the loved ones should have when it comes to patients with multiple sclerosis.
Mhm.
Also, how can patients effectively utilize the support networks and community resources? So I'll move on to a discussion that you mentioned regarding the treatment or preference regarding pregnant women. Could you elaborate on that and how do you treat your patients with such specific needs?
See, usually at the time of the diagnosis, maybe not at the time of the diagnosis, but the second visit, when a person is more comfortable, even if the patient would not volunteer, I, as a doctor, usually would ask them, what are their plans about marriage? What are their plans about childbearing? So as I discussed, sometimes these plans would help us decide the correct medication for the correct patient. Now, somebody who's planning a marriage maybe in the next 3 to 4 months, and maybe planning for childbearing the next year, drugs which have a better safety record, like interferons, peg interferons, with a milder disease, would work very well. So most of the patients would actually do well with their pregnancy. A lot of patients have fear. Can I actually plan a pregnancy? What will happen to my medications? What if I get another episode at the time when I'm pregnant? But actually, pregnancy is a special state from the immune status in the body, because when a person is pregnant, there is the child or the fetus. To accommodate the child or the fetus, the body lowers its immune level. So actually, most of the women would rarely get another relapse during their pregnancy. What is the period to look for is the period immediately after delivery. Now, that is the time when actually higher degree of relapses are often observed. So, generally speaking, most of the women with appropriate planning and counseling can plan pregnancy and have good outcomes of their pregnancy.
Ma'am, just by hearing your thoughts and your insights on how to take care of multiple sclerosis, how to manage it rather during pregnancy, I have a question. How does the integration of different fields of medicine come into play when managing such cases? How about someone who's just diagnosed with MS during pregnancy once they've conceived? And how
Yeah.
is the management different for those who had multiple sclerosis and were successful in conceiving? How is the management different for the two cases?
See, if the patient has had a very stable disease and a previously diagnosed case of MS, we discuss with the family whether we can stop medications for some period of time during their pregnancy, depending upon what kind of medications they are on. Or for certain medications like interferons, the same medications can continue during the pregnancy. Then would come a person who's newly diagnosed. Now, that's a relatively trickier position compared to somebody who was where we were prepared with the disease. So, if somebody is newly diagnosed with MS at the time of their pregnancy, what we do is we would give them methylprednisolone or corticosteroids to cover that particular event in their pregnancy. And if the disease is relatively stable, we would put them on disease modifying therapies after their delivery. So that has to be decided on a case to case basis depending upon the severity of the disease. In fact, some of the highly effective medications can also be planned around the pregnancy. So I would not go into the technical details, but it is feasible that you give one dose before the person gets pregnant. If the disease is very active, redose and then give one dose immediately after delivery, because that is the time when we are most worried that a person is going to end up with a relapse.
Ma'am, while you've already discussed about how important and effective support networks can be, what are some of the key strategies apart from having, being a part of a support network, important to maintain a positive outlook and improving the quality of life for those living with multiple sclerosis?
See, life of different patients with multiple sclerosis can be different depending upon what is their extent of disability. So we do something called as EDSS scoring. So there will be a lot of patients whose EDSS score would be 0 or 1. So for them, it will just be a matter of regular checkups and some regular medications. So no matter in which phase of the disease you are, something always can be done. So remember that. And second is, see, whatever, instead of focusing on whatever is lost because of your disease, focus on whatever is left and plan out strategies to make the best use of what you have. So that is always a very good way to prevent going into the cycle of depression.
All right.
So that is very important. I mean, what kind of job would suit you with the current level of disability? So
Definitely.
that is important.
Ma'am, as we come close to the end of this session, one of the questions that I had was what are some of the technological innovations that are helping patients with multiple sclerosis stay active and maintain their independence?
So the technological innovations can be broadly divided into assistance with voice, robotic gloves, which would help. Some patients would have impaired dexterity, wheelchairs, which have automation. So all those things actually go a long way. So rehab is one very important part of management, the symptomatic management of multiple sclerosis. Then things which would help with the bladder control. Continence is again one big issue. So there are a lot of things around which can help our patients.
Definitely. Ma'am, can you share some of the success stories of individuals who have thrived despite of multiple sclerosis and the diagnosis, and some of the lessons that our audiences can learn from them?
I would say most of our patients, they do well. So if the diagnosis is early, that is the key. And the patient acceptability of the disease and the treatment is good. So if I recall, I had one lady who's a dancer. So she's a professional dancer, and for her, the diagnosis came as a problem because she started getting tremors, which were interfering with her routine. But then now with proper medications, she is independently managing both her profession and her household. So, most of the people would live a normal life. That is what I would tell you. So, then I can recall one more young person who's now a top business person. Again, diagnosed in his 20s, and now practically not having any disability and doing well. So disease is not a barrier.
Thank you so much, ma'am, for helping our audiences look at the brighter side and highlighting the importance of early diagnosis of multiple sclerosis. As we conclude, ma'am, I request you to kindly give your conclusion remarks.
So, multiple sclerosis is a autoimmune demyelinating disease. It affects the young, women more than men. Diagnosis is made in conjunction with your clinical symptoms and is helped by techniques like MRI, VEP, and spinal tap. Early diagnosis prevents disability. Early aggressive treatment often helps us live a long period of life, which is disability free. Positive attitude mm, helps and goes in a big way. You don't have to fight the disease alone. Always take help of your family, your well wishers, and your community resources to fight this disease. Educate yourself about this disease because most of the doctors would take important decisions after discussing with you. So, what you want from life, what are your challenges, what are your preferences, are as important as the decisions taken by a doctor. And often, when we treat multiple sclerosis, we don't treat them as doctors, we treat them as a team. And our patients are a very, very important part of that team.
Thank you so much, ma'am, for your valuable insights and time today. Thank you.
Thank you very much. Thanks. I had a pleasure. Yeah, I had a nice time.